Then Dr. Veena, can you able to unmute yourself?
Yes, sir.
Yes, please.
Good evening, one and all. It's immense pleasure for me to introduce today's speaker, Dr. Radha, who has been our expert earlier as well. Radha has completed her PhD in learning disability, and also she is the director of one of the institutions, rehabilitation institution that deals with autism kids, and also she has done various international and national programs on autism-based programs as well. And she has taken sessions earlier too on learning disabilities as well as autism spectrum and also ADHD. It gives me immense pleasure to invite Radha once again, and the floor is yours, Radha.
Please unmute your audio.
Thank you, Veena, for that wonderful introduction about me, and thank you, Suresh Kumar sir, for this opportunity to share my knowledge about special needs children. So I will share my screen now. Whether screen is visible, sir?
Yes, yes.
Okay. So today I'm going to talk about parenting for special needs children. We know parenting is a very, very tough job. It's a 24/7 job. So we have to be monitor our child. We have to handle our child. And then if it is like that, we have to think about special needs children. So how their parents will be handle them. So they will be in the stressful situations. And then the kid like autism spectrum disorder, and the parent don't know what they will be doing in the next moment. That itself is a big challenging for the parent. So today, what and all the basic things I'm going to address is the first and foremost, parent has to be take care of themselves. That's most valuable, because I see lot and lot of parents who is not taking care of themselves. They will be 24/7. They will be thinking about the child, and then they are totally depressed. So first, I will give you lot of ideas and tips about how to take care of special needs parents. And the next, what and all the challenges they are facing. And then during this COVID time, they will be facing a lot of immense challenges. So because the child is at home and then they don't know how to handle the child. So all this will be I'm going to address, and then I am going to share here some parenting tips, and then some parenting tips for autism spectrum disorder. And I will start with Poonam Nadarajan. She is founder of Vidya Stagar, a Spastic Society of India, and she is a chairperson of National Trust. She is a special needs mom. And our vision is she observed what and all the difficulty our son gone through. So she wants to overcome. She not only she empowered herself, she also empowered other mothers also. And that's what she is very famous in special needs children's group. And what our quote is that celebrate life, celebrate diversity, and let the energy flow. And our main motto is to promote community-based rehabilitation strategy is locally, regionally, and globally. So she is one of my inspiration as a special needs mom. She not only taking care of her son, but is also to empower other special needs mother. And then she gave lot of training for special needs for a special educator also. Children with special needs paint the world with beautiful colors each day. Yes, they are paint the world with beautiful colors each year. And next, special needs. What is special needs is an umbrella term for a wide array of diagnosis, from those that solve quickly to that will be challenged for life, and those who are relatively mild to those who that are profound. So mainly special needs means it will covers developmental delay, medical condition, psychiatric condition, cognitive condition, and it requires accommodation to the children to reach their potential. And we have no special need children, just children with special needs. That's a very famous quote. So special needs mom, they have to understand that, because they will have lot of myth about their children. So before we go to special needs mom, what and all the different types of special needs in the children? So first one is a medical behavior, which is comes under ADHD. Developmental, it can be a developmental delay, cerebral palsy, Down syndrome, and then learning, it will be a learning disability, slow learners, and then mental health. So there are four major types of special needs children. Physical is mainly muscular dystrophy, multiple sclerosis, chronic asthma, and then epileptic, and then even cerebral palsy also. And then developmental disorder is a Down syndrome, autism, dyslexia, processing disorder. And all these four major categories is already there in the classification. And then behavioral and emotional is attention deficit disorder, bipolar, and ODD, and then sensorily impaired is they can be visually impaired also. So why we have to look for early childhood development? Many parents, they brought their child around 13 years, 14 years, and then even 8 years. Even today also I get a call that their son is 8-year-old and he is still non-verbal, not even speak a single word, and then they don't know what to do. So for that, the early intervention is very much important. So only the early childhood development is essential. So parent has to be first key factor is they have to think about the child milestone. Usually the parent who have a premature baby, they will be tracking the milestone. But other parents, they may be just overcome. Like in social development only, autism spectrum disorder, we can be find it out. Even 6 months baby who don't have a social smile, and then the child is not tracking wherever the mother go, it may be one of the characteristics of autism. So the parent has to be identify each and everything. So emotional delay, and then speech and language development. Usually 3 years only the parents will be noticed that when they want to enroll the child in the school, they will be thinking about why my child is not able to speak. They have to attend an interview in the school. But 6 months itself, baby will give lot of different types of sounds. They will be, it will be Q sound, they will be da ba 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 da da da, like the different types of sound. So if the child don't have produce that sound, we may think the child may have a speech delay. And then cognitive development, that is also very much important. And then physical development, if the child did not reach the physical milestone, that is in 1 year the child did not reach the walking or head control, staircase climbing, jumping, like that. If the child has a developmental delay in physical development, it will be leads to the social development or cognitive development. So that's what the early childhood it's very much important, because 0 to 6 year children develop a necessary skill for physical, cognitive, social development. Early education play a critical role during this developmental period, and early childhood education makes a positive impact and give a child a head start towards a bright future. So if the child has some difficulty in physical development, immediately the parent has to address, because even 14-year-old boy, the mother carried from southern part of Tamil Nadu, which is from Erode. So they from bus they carried. So the transportation, the accessibility, everything, they will have lot of difficulties. So early intervention is very much important. And then what and all if the mother find it out, the child is special needs, they have some special need, if the child is special needs, what's the first and foremost mother's reaction or a parent reaction? When your parents identify that his or her child suffers from disability or a chronic illness, it's becoming a challenging task for them. Initially, yes, of course, even when we have our child is not well, or they are not perform very well in the exams, we will be somewhat down, because for a parent the child is everything. If initially when the parent went a diagnosis, if there's many parents who comes to me when I tell them their child may have a autism spectrum disorder or a ADHD or a learning disability or a physical delay, like that, they will be immediately, there will be lot of questions will be there in their mind, and then they will be totally confused. And first and foremost, they will be think about their family members. So I've seen in this 18 years of experience, I've seen lot of parents, because of the special need children, and a divorce happened, and because of that, the mother-in-law issues, and then social stigma. Altogether, it's a big pressure for the mother. And now, for past 5 years, I've seen that both father and mother who give an equal importance to the child. So the parent will be feel alone and isolated. And what the parent will on first discover the child has some disability or some difficulties. So initially they will have some parent, they describe having a knife stuck in her heart, and was so confused that I can recall else about the first day other than the heartbreak. So all these moments will be there. They don't know, because that day, that night, they won't sleep at all, because almost all the special needs condition are lifelong. So first thing what they will be asked is whether it is curable. Why my child is only why my child? Because there is in my relatives nowhere no child. In our family only this child. Why my child? Whether I did some mistake, whether it's in karma, whether they will be asking so many questions. So on first day, it will take me for 1.5 hours to 2 hours to clarify, because when they have some mental block in their mind, and then they will be thinking about the worries, thinking about the baby, they won't focus on the child development. So first and foremost, I have to clarify what and all doubts the parents have on the first day of meeting. So this is a famous thing I always share to the parents, that your child is the same person before autism diagnosis as they are after the diagnosis. Your actions and lifestyles may change, but your love for them never change. Yes, their love for them will never change. And then what and all the common reaction of parents? First, denial. Yes, many learning disability children, even autism, hyperactivity children, the first and foremost, they will be denied. No, my child is not there. Usually what many parents, they told me, see, I gave a phone to him. I don't know how to operate the phone, but immediately my son goes to the YouTube and then he's watching the video, and then how you can tell my son is an artistic or a hyperactive or a learning disability? How they will be first thing, they will be denied. For learning disability child and all, the teacher will be give some complaints like your child is not focusing on the studies, and then they cannot able to sit in one place, they are easily distracted, like that lot of things teacher. So immediately they will be denial. No, my child is not that. Only usually many parents, they told me that at home my son is doing all the work. Only at the school he did not perform. And then there is a conflict between the teacher and parents, and then many parents, they also drop the child from the school because they cannot carry on with the school's curriculum, or they just drop out from the day. So first thing is denial. They won't accept first. Even the developmental delay, even 2 year, even I think from Tiruchi, there's one boy who is a 4-year-old boy, and then he's still in the developmental delay. The boy, when he comes to me, he can able to head control is partially achieved, but he can sit with support for few seconds, not more than that. But for that thing also, the mother told me that no, my husband started walking after 5 years. Even my grandfather, who is also a delayed milestone, but my husband is performing very well. My grandfather, and then almost they will be telling this denial. So they will be usually telling you, no, no, no. I started speaking at only at age of 6. Then what about my son? No, that time is different. This time is totally different. So that one, the parents has to understand that they should not deny, they should be accept some difficulties is that. And then anger, which is directed towards the medical personnel who provide the information regarding the problems. Yes, they will be anger. No, 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 my time. So they, and then grief. Sometimes which may they not know how to explain and deal with. And then mainly it is fear. It is an immediate response shown by the most of the parents. They usually fear for unknown than for known. They fear regarding the child's condition that will be worsened, and fear almost immobilized the parents. And guilt. Yes, they will have that guilt feeling that, okay, regarding whether there are the reason for this. They will be telling their many mother, they cried to me that their mother-in-law or in some places when they went to some family get together, they told that I am very bad, I did some mistake, that's what I have this type of special need child. So and then it is because of karma. They will be telling all this when the parents hearing all these things, they have to take care of the special need child, and that too they have to undergo a lot of social stigma. So they will have that guilty consciousness because of me, and then maybe manifest in the spiritual and religious interpretation of blame and punishment. So when mother who is taking care of the child very well, but still, no, you did some mistake. That's what your son born like. That means how much she feel. That we should not be sympathetic. We should be empathetic to them. And then confusion makes it will be confusion lead to sleeplessness, inability to make a decision, and mental overload. And then powerlessness, yes, they will feel more and more powerlessness. It's very difficult to accept. It's very hard to rely on judgment, opinion, recommendation by others. And then disappointment, and then threat to many parents' ego, and challenge to the value system. Yes, recently I did an online consultation where the mother is a scientist, and 8-year-old boy who is hyperactive, he won't sit in one place. So what happened? The scientist mom is very disappointed, and then she asked me, I am a scientist. How can my son cannot able to study? So they will be think about their graduation, and then they will be thinking about the kid performance. So it is totally different. So the parents should not think about their graduation. When it is comes to many parents, they told me, I am a PhD holder. I am a excellent professional. So I am a HR professional. I am a CEO of company. But why my son is like that? All these questions will be there, and then rejection. Yes, they will be rejected towards the child, towards other family members, serious for rejections and not common, uncommon. So for me, is see the label. See the able, not the label. Yes, we should not tag any special needs children like autism, ADHD. We have to categorize what and all the scientific characteristic they have to how to overcome the characteristic. As each child is unique, means each special needs child is also unique. So till now, I just briefly explain about the parental emotional trauma once they find it out, their child diagnosed as a special needs child. So now what and all the challenges they will be using. First is accessibility. So for it is very difficult for developmental delay, cerebral palsy, spastic child who is having a transportation, they are more dependent on wheelchair, means it's very difficult for the mother to assess if there is not much of ramp and lack of adequate toilet provision. So changing the place in the toilet, even the footpath. So for that itself, they won't bring the child out. And then behavioral issue. They may not respond to the traditional discipline. Their diagnosis like ADHD and sensory processing disorder required a specialized strategy that are tailored to the specific need. So usually, because of the behavioral issues, many autistic parents, they won't bring the child out. Many parents, even one of the parents, she told me that even she did not went to her sister house because once the son entered into the sister house, he started screaming. And then he don't like the place. And then many parents, they told me that today also one of the parents during the online consultation, they told me that they cannot go to any marriage function or any get together because my son is allergic to the loud noise, and then auditory processing disorders is there, and then my son is even he don't like to heavy lights or like that, so he won't. So because of that, because of the child, they cannot go out. And then communication is a huge challenge for parents. Those child have communication difficulties. Yes, mainly for autism child and all, they will be a non-verbal, or they will have a behavioral and sensory issues that affect the way they come. So parents don't know because if the child is non-verbal, they will be inform the world according to the behavior pattern. It can be any tantrum, they can be through lot of tantrums. Because of the behavior only, we can understand what's the child need at all. So the parent don't know what's the child need to communicate, what's the child's brain. So that's where the parents, most of the parents get depressed. They don't know what my child's feeling, inner feeling. Then can address them. So that's the communication. Another most thing is some parents juggle dividing a love between the child with his medical condition and a healthy children back home. And then many parents, they just quit the job. I've seen many parents who are in a highly skillful job, and then they quit the job, and then they will be focused on only the kid. And then what happened? They quit the job, and then they will have that depression. Oh my God, yeah, I cannot go personal growth. My professional growth is not there due to my son or my daughter. So they will be thinking about that. So they quit the job, and then they will be 24/7. They will be thinking about the child, and then they will be providing wonderful service to the child. And most of the special needs children have spent time in hospitals, therapy center. So this is, and also for a therapy, they have to come weekly 3 classes or 5 classes. So they have to spend more time in the therapy center or in the hospital. And then many parents, especially mom, told me that they are very, very tired because they have they don't have a sleep. The many parents, they cried to me that they did not sleep for more than 5 years. Whether can we imagine that more than 5 years? Because their son, even a small drop of water drop itself, the son will wake up. So they are very much panic and anxiety also. And then during this COVID-19, so till now, they will have a strict routine. Special needs children, they will be going to the special school or a normal school according to the classification of classification of disability disorder they have. But after this COVID, almost all the kids has to be there at home. So they don't know what to eat. We can imagine that even our kids are at home, so they are totally in the boredom. They will have classes for 3 to 4 hours, and then they will have to do some homework. But still, they miss the social interaction, communication with their friends. They can see through the video, but still when they go to the school, they will have social skill is lagging during this COVID-19. Even for that only, I also closed my clinic and then doing only the online consultation because of the safety and security. So all this, the child who is a special need, they a lack of the therapy program during this time, and then they don't know how to handle the child. Many parents, they called and they cried to me that they are very difficult to handle. They have more and more behavior tantrums and behavior pattern and negative behavior pattern. What and all they did also, the child immediately thrown, and the non-verbal child is somewhat difficult. So for them also we have to give a special that's what each and every child we have to provide a therapy technique according to the child's need. And first and foremost, what and all the parenting tips? First, they have to look after themselves. If they look after themselves only, they can take care of the child. If they have the pre-recorded mindset, if there's something is pre-recorded, okay, my son is like that, I'm worried, and then my mother-in-law told me like that, and then my husband told like that, and then the auto wala did like that, and taxi wala told me like that. This is and all pre-recorded mindset. When they're having the pre-recorded mindset, if the child gives some behavioral issue, it will be make them more panic, and then they don't know how to handle the child. So the first foremost advice I will be giving to the parents is, if they are presence of mind, that means if they are at the present situation, they can handle most of the behavioral issue. They itself know how to handle their own child, because the child is having some behavioral issue, means there will be definitely there will be one reason, so they can easily identify the reason. So the mother has to be deserve to be cared for first, and then stress management is very much important. They should not think about the child future. Many parents, they are very much afraid and then fear who will be taking care of the child after 20 years, 30 years after the death, or something happened to the families, who will be taking care of the child? Because the child is totally depending upon the parents. Then they are the superhero. Being the parent is hard, and being a parent to a child with the extra need is a extra hard. Parenting a child with the extra need is like a marathon. Yes, we have to, parents with the special need, they have to run every day like a marathon. And then they should have a quick sense of humor. They should not think always about the problem, and then they should think about the solution. Then they will be think about, so they have to celebrate a little thing. So what I usually to the parents, that if your child achieve a small development, enjoy it, celebrate it. If don't expect major milestone, okay, once my child started walking only, I will smile. Not like that. Even when child achieve a sitting balance with support, and then crawling with support, like that means itself, they have to celebrate the little thing, and then don't compare with other child. Many parents, they compared, and then they asked me that my child is also artistic, that child is also an artistic in the during the clinical section. Then that child is performing like that, why my child is not performing? Because each child is totally different. Don't compare with other child, and stick to the schedule. Even during this COVID time, stick to the schedule. You just, if the child, you just think that your child is asked to go to the school, and then stick to the schedule. And then most important valuable is express your love to your child. Many children with special needs do not know how to respond to the emotions and love of the parent, but they certainly need that love and protection. So there is nothing wrong in expressing a love to the child. The child may not respond to a kiss or a feel uncomfortable to a hug, but there are other ways like playing together or watching TV together or reading a story and doing an activity together. And some more parenting tips is that a physiological look into the things. As a child, brain is most formative and then is just like a very soft during the early years of his life. With the appropriate methods and stimulation, neuroplasticity will allow the brain to repair, and it will create a path where the child can learn and relearn to use the function. That's what I previously I told, that early intervention is very, very essential. And then incorporating functions with the daily life. So when how we can then simply attending the therapy section for a few hours per week, it's not enough. Many parents they asked me that they are attending few weeks whether, but continuing the therapy at home, you will integrating daily function thought in the therapy with the child's daily life. So parent has to be provide the therapy now and then. That's what I usually tell to the parents. So oh, it's not only therapy we provide or during to the online consultation. They have to apply all the therapy techniques now and then. And then only another important thing is when the parent who have a belief on the therapy, their children will do lot of wonders. If parents have some confused like whether the therapy will improve the child's condition or not, then how much effectively if you provide the therapy also, there will be some lag. So the parent has to be believe therapy will give lot of improvement in the child, and then by that the child will go to the next maximum potential. And therapy is a play. Therapies and clinical intervention are good option to help your child. And foremost important thing is show your child how to do it and do it with them. Watch him to do and let him to do it independently. Yes, independently child has to perform all the activities. So that's what first you show to your child. Even during online consultation or at the clinical setting, I will be keep on repeating the same thing for 10 to 15 times. Today morning is also, if the boy name is Pranav means P, R, like that, each word I will be explaining because it will be registered in the brain. And then when the child wants to reproduce, it can, because usually autistic child, when we ask the question, they won't immediately respond. But it will be there in the brain. So like that, when we give adequate information to them, and we will lead them to be independent. And then build a good relationship with the therapist and then school. That's very much important. Because if you have any doubts regarding the therapy, you can ask the therapist and then clarify it. Okay, my therapy is like that. Why you are doing it? You have the rights to ask about what and all the therapies your child is undergoing and what and all the improvement. And then another important thing is usually parent will ask the therapist that how long the therapy will take, how long it will take. It is depending upon the each individual kid. Usually it may be 1 year to 2 years, some improvement has to be there. So the parent has to bring the child for 1 year to 2 years, but still it's depend upon the child. So they will have, and then they will ask, okay, how long it will take, and then whether a child will be overcome all the difficulties, whether it is curable. They will have lot of question marks. So first, my suggestions is first you write it down what and all the characteristic your child have, then we can provide according to the therapy. Not only that, if your child became something differently, you can respond, you can inform the therapist about if the child did something different. Okay, if my child did like this, so what I have to do it to the child. So open up. It's not only that therapist are giving and then you have to do it at home. It's not that, you have to open up. That's what I will be doing. I will ask the parent to write it down in the diary. If child did something different, if the child wants something, but the child has difficulty to express, they have to write it down. So whenever they meet me, they will be ask me that, okay, the child respond like what they can do. So like that, instead of getting panic, instead of getting, okay, my child is doing like that, what I can do? Instead of panic, they can think about the solution. If they think about the solution, definitely they can handle the child in the positive reinforcement. And then remembering the parenting a child will be a hit and trial method, and you will be face a several obstacle and many of your method may fail, but at the end you will be recap the rewards as you will witness your child's growth, and efforts put in the nurturing a special needs children are rewarded. You will be delighted to see your child with special needs growing and learning. You will witness how hard your hard work and efforts are paid off your way. Yes, whatever effort you are giving to a child, definitely it will be paid off. And then that too, it should be in the positive form. And then special guide to then autism treatment. So first, don't wait for your diagnosis. Many parents, they will be wait up to 4 years, 5 years. In the research itself, the usual diagnosis take place around the age of 4 or 5. So don't wait for the diagnosis. If you notice your child has some lag or some difficulties, immediately you approach a therapist or a pediatrician and become an expert on your child, because it's your child. You can analyze each and everything. Even in autism, we have an eye tracking movement. So if the child moves the eye to one side, the parent can be identify what's the child need. So you can become an expert of your child. It can be autism, it can be a hyperactive, it can be a learning disability, it can be a developmental delay, it can be anything. But still, if you know the each and everything of your child, you can find it out, because there is a lot of special needs moms who discovered a lot of special therapies, and then many special school are founded by many special parents. So they will, because they will have that, okay, my son is like that, what I can do. Even for learning disability also, many special the parent itself innovated lot of remedial programs. So they can be expert, become an expert of a child. So that's what I usually tell to a parents. Instead of worrying about the child, think about what your child's potential, what and all your child can do, and what and all the lag. If there is any lag, how to overcome the lag. And then be consistent. Even if you are going to therapy, if you bring your child to the therapy center, or whatever it is, if you are going to plan to teach some functional skills or special education or any type started of therapy, be consistent, because the parents, they will be shifting one place to another. What happened? They will be taking therapy in one center for 1 month, and then they will be shifting. Okay, there is no improvement. They will be keep on shifting. So when they keep on shifting means there will be a delay in the improvement. So be consistent. Wherever you are undergoing therapy, you ask so many questions to clarify your doubt. Don't keep it inside, okay, and then they did not do the effective therapy at all. You clarify your doubt and then stick to the schedule. That is very much important. Always stick to your schedule. It can be a morning routine or it can be a night routine. Stick to the schedule, because autism child, they are very much interested in regularity. If we break the regularity only, they will have the disturbance. So even in this, during this COVID time also, you can stick to the regularity, and then reward good behavior. Always reward good behavior. Appreciate them. You just give a simple clap to them, and then have a cheerful expression to them. That itself have a big reward. It's not the reward means it's only a chocolate or any sweets or anything else. That is all the negative impact. You just have a good like clapping or just a cheerful expression and big smile. Hey, you did it, like positive words will make the child to process. So that by that itself, child knows that he did some good behavior. And look for non-verbal clues. That is very essential for autism treatment. They have to look for non-verbal clues. When the child is keep on moving the hand and then is thinking something itself, means he is going to going to throw some tantrums. So they will have to look for non-verbal clues and figure out the motivation behind the tantrums. Yes, why the child is doing this action. So each behavior, there will be a action and then there will be a consequences. So why the child is behavior like this? And then pay attention to your child's sensory sensitiveness. Usually artistic child, they will be sensory processing disorder. So we have to pay attention why the child and if the child has some sensory issues, they have to pay attention. And then my request is, many parents, they told me that because of the auditory vision, they won't bring the child out. But initially, during that early intervention, 2 years, 3 years itself, when you bring your child to the social scale or social world, they will adapt everything. As during this online consultation from Pudukkottai, 2.5-year-old boy who is very sensitive, even a small sound itself, he will be close his ear. I request the mother to bring him out during this COVID time also. You just go to the temple. The mother told me even the temple bell itself, if there is some sound itself, he will be so much panic. So what I ask her, go every day. Have that, let the child hear the temple bell. Now mother told me that now the child can adjust the auditory frequency. Now the child don't show any behavior pattern because of the auditory. So we have to adapt the child. Usually artistic child, they won't adapt. So we have to adapt according to the environment, the society. And then parent has to know the child's strength and weakness. If the child has some strength, they have to make the strength to be a potential and then big achievement. And then what behavior causing the most problem? What important skill is my child learning? This is all very vital. Parent has to know about this. How does my child learn best? By seeing, listening, or doing. How does my child enjoy? And how can those activity can used in the therapy and bolster training, like that. So the parent has to be identify each and everything, whatever the child do itself, they can itself handle the child effectively. Parenting a child with autism is an endless series of repetition that can be lot of exhausting. What we have struggled to get them to learn takes hold, and rewards are amazing. Yes, rewards are amazing. Parent has to be it's not trying. We don't use try. Parent has to must put lot of effort. Definitely they will get a lot of reward for that effort. A treatment method or educational method that will work for one child may not be work for another child. So the one common denominator for all the young child is that the early intervention does work and it seems to improve the progress. Yes, the early intervention is very essential, not only for autism, for all the developmental delays. And then this is a program where I did it in my PhD, which is a Brain to Act program. This one is it is a research based program where it improves attention, concentration, memory, thinking skills, motor skills, and balance and coordination, eye and coordination. And it is a movement based therapy program for autism, hyperactive learning disability. And then in this program I also included reflex integration therapy program also. By that, even the learning this developmental delay, when we are providing a physiotherapy for developmental delay, if I include all this type of therapy, it shows lot of improvement, a quick improvement for the kid. Why means currently I am providing a therapy for a Sudan. From the child is a 2-year-old, a developmental delay child who has difficulty even for sitting. So during this 3 months time, the child can able to sit by himself, and then we just started with the walking gait pattern, the walking training. So it's not only we have to provide the physiotherapy or speech therapy, what and all the essential, the additional supportive therapy also when we provide to integrate the brain, left and right brain, it will make the child to think and do the activity voluntarily. And this is some of my online consultation for parents and child. So every child is gifted. They just unwrap their packages at their different times. Therapy is not meant to make it so that your child is no longer artistic. It's to help your child succeed with autism on despite of it. Some people with autism may not able to speak or answer to their name, but they can still hear your voice and feel your kindness. Someone with autism taught me that love needs no words. Yes, each and artistic child, not only artistic, almost all the developmental child teach me every day what I am thinking about. They only make me to do lot of research work, and then if the child did some differently, why the child is doing like this, what and all the possible answer I can give. So they are my thinking factor where I can think about themselves and then I can provide the effective therapy for them. And now I like to share a video. His name is Praveen. He is a mild artistic and currently I am providing an online therapy for him. The beauty is whenever he get irritated, I will show some social clue cards. So by the social clue cards, he himself will tell, okay, I get irritated. What I do is I will calm, I will wait, I will think and do exercise, and then I will do again. Almost, he will repeatedly, he will say, and then he will calm by himself. That unique child is, and he is very famous in Bangalore in this instrument. And then I like to show his video to you. 1 minute. I just stopped share the screen and then I will share it again.
Yes.
Whether can you hear? Whether can you hear? Whether
Yes.
can you? Yes. Okay.
Yes.
Always be happy.
will stop share and then I will do the normal share. Okay, he's Praveen, and our mother. She is so privileged to have our son Praveen Rohan. Though he is a special child, given by ultimate the fullest ability and talent in the art of music. So we request every parent to have highest confidence on their special children, and that's our mother quote. And then our mother, and then even his father, both are so much involved during the online consultation. And then they will be whatever doubt they have, they will be clarified with me. And then now they told that now is slowly the behavioral issues are slowly going very down. So thank you so much. When someone gives me something, I will try to say thank you in the autism word. Thank you so much. Thank you for this wonderful opportunity. So I'd like to. So last three times I just shown you a lot of exercise. This time I'd like to have show you some visual treat for an artistic child for his performance. Hope you will enjoy this performance and then give lot of appreciation for him, because he is doing this everything. If he have some bad mood, he won't do, but today luckily he did it for me. And then immediately he told whether did Radha auntie will show this to the webinar and all. He asked me, so thank you so much. And then over to you, Veena. Yeah.
Yes. Thank you so much, Radha, for that wonderful presentation, and special thanks to that little chap. And please do convey our wishes to him.
Definitely.
That was so nice seeing him shining so well. And definitely, this is one of the best sessions we ever had. And participants, the forum is open for question and answers. You could unmute yourself, or you could put it in the chat box so that I can facilitate the question and answer session.
I'd like to thank this opportunity to Suresh Kumar sir, and he's head of the Department of Madurai American Department of Psychology, Madurai American University, and then Dr. Veena, who is always encourage me and support me, and then with her beautiful smile itself, it's for me. And then the way she introduced me, it's also thank you so much, Veena. So if you have any questions regarding this, you can ask me.
Yes. The chat box is flooded with feedbacks. So definitely your questions will be coming in that. I'll just go through that rather. Yes.
Yes. Thank you for appreciating Praveen. Thank you so much. Definitely, both the parents and because they are full. Almost everything they don't think about anything else. They will be think about only the Praveen. And then thank you so much. So definitely, I think Praveen mom is over here. The Priya is Praveen mom. Praveen mom, whether if you are here, you can share it in the chat box. You can say some few words, because there's a lot of appreciation for Praveen. Are you there, Priya? Yes means you please keep it in the chat box, so we can have some word. I don't know which Priya it is, but okay.
So before others shoot the question, I just wanted to know, like, what were the difficulties you found while working with Praveen, Radha?
Yeah, actually, I won't tell difficult. It's challenging, because Yesterday also, his mom told that even to go to the next room, he feels somewhat afraid, and then he told, I don't want to go to music room. And then I just think about, okay, what solution I can do. Definitely Praveen, like Praveen, he is making me to think further what and all the solution I can give. So immediately the mother will ask me, okay, today he is upset. So what I can do means, she will be ask me, and then definitely I will be tell, and then immediately she will respond, and then not only her, even Praveen also WhatsApp me, Auntie, I did this. Thank you so much. So that's so nice kind of boy is.
Yes, and definitely when he has a therapist like you, definitely he wouldn't have the heart to say no to whatever you say. So we
Thank
have the question rather, yes. Ma'am, if there is a 5 children and the parenting style and caring for each 5 children is same means, ma'am, Induja ma'am, can you please clarify the question? I mean to say if there are 5 children and different parenting styles, will the 5 children have the same abilities? I think that is the question.
What can you repeat the question? Uh, yes, I will just go through.
I think if there are 5 children and the parenting style and caring for each children is same,
Mm.
the children's character and their abilities will it be same?
Okay. Actually, I think Vino also know that the parenting style may be changed, but the characteristics, everything is depend upon their gene, and then their environment, and then how the parent brought up. So it has a lot of factors. So we cannot tell like this particular parenting style children will be do lot of wonders. We cannot say like that. So we it will be each parenting style is totally different. So parenting style is comes from usually from our parents, how our parents have brought us, and how our parents, whether they are strict or whether they are very calm and composed, and then like that only we will be giving parenting to our kids and all. Definitely it cannot be same. That's what I can say. Like carrying also, it cannot be same, because each child has their own uniqueness. Even we can give you parenting tips, but they have a unique gene, so according to that only they will be performed. I hope I
Yes,
answered that.
yes. Thank you, Radha. I think Satyaji has a question. Satyaji, can you unmute yourself?
Yeah, actually, I was not able to do that time.
Yes.
Thank you, Dr. Radha ma'am. It's like every session I attended 3 sessions of yours, and everything is it's excellent. It's too. I learned a lot. For a budding therapist like me, it's of very every day I make use of your each and every line of yours, and the way you present it. So most of them I keep writing. When you present, I try to listen to you more so that I get more out of your this thing, and the energy which you have, that's something extraordinary. Thank you so much. And
Thank
this particular topic is eye opener for the therapist also, and for the parents also. I hope so, because like most of us, that we don't insist speak more about this particular topic. So thank you so much for that, ma'am. Thank you. Gratitude from my side, and thank you, Suresh sir, Veena ma'am, everyone. Thank you so much.
Thank you, Satya. Thank you for your continuous support and encouragement. Definitely. Thank you.
Uh,
Good evening, everyone. Am I audible?
yes, ma'am. Please go ahead.
Yes.
Ma'am,
Yes.
I'd like to know.
Yes.
Shab, yes. Shabnam, can you type the question in the chat box? I think you're not audible for us.
Hello. Deeply.
Yes,
Yes.
yes.
I think I'm technically too, ma'am. I wanted to know, thank you very much, ma'am. With your experience, ma'am, please share your thoughts or your experiences with respect to how these people later are able to support themselves financially on their own. Have you come across some children who have been independently with their needs children?
Yes, definitely. Even Down syndrome children, they can become independent, and then even artistic child. Because for us, for past 10 years only, we know about autism and all. But even for me, 25-year autistic boy who is very good in coding, and then he's working out, and then that's what but they need some support from the parents, from small support, but otherwise financially they can do lot of activities. Even recently I read an article about Down syndrome who is advocate general also. So like that, even an artistic boy who is very good in what's that, creativity, like artificial intelligence, autism boy who did some artificial intelligence. So like that, because they have lot of potential and creativity, parent has to bring it out everything. If they bring it out and do some support, definitely they can also be independent as also. Yeah.
Thank you, ma'am. I think Down syndrome is something which I've never crossed myself. So, I mean, with that, assuming they have a higher IQ, I don't know. I mean, they
No,
don't
no.
have
Down
any
syndrome.
intellectual disability.
Down syndrome. They will have low intelligence, and then they cannot go to normal school, or some way they go to normal school. As a Down syndrome children, they are, but they have some potential. They cannot go, like occasional means we should not think about, okay, they will go to college and then they will have some degree, like that. Even occasional means they are very good in embroidery, or in candle making, or bakery. Even in Malaysia, once the time I went to Malaysia, a group of Down syndrome, they started uh, baking institute, and then they teach, and then they give baking like a cake, and then they prepare birthday cake and all. So that's the potential. Always when we think about financials means, we will be think about going to college and then we will have some degree and work. Not like that. They can be a singer, they can be a dancer, they can be any potential. Whatever potential they have, we just give some key to that. Definitely they will be shining that.
And
Ma'am,
in recent,
sorry, ma'am, I just heard that Down syndrome person being an advocate. I mean, I'm not very sure. Did I hear it correctly?
Yes. You can Google it. You can Google it.
Okay, thank you, ma'am.
Yes.
yes, not only that, even people are venturing into entrepreneurship as well, and there are first artistic supermodels as well coming up. So really, there is a lot of support to such sort of kids, and parents are really trying to understand and encouraging and trying to get their talents out. And also therapists like Radha are making their transformations, which we could today see live. So thanks to all. And yes, yes, we have KFC in Chennai also. Satyaji has told, yeah, there are a lot of dine-ins that are like really trying to recruit such people. even Hotbreads is also making job opportunities for people with autism as well.
Yes.
So yes, change is happening with the mindset of people as well. So thank you so much, Radha, for this wonderful session. Like I say, you give the complete package in a nutshell, and that is the beauty of your presentations. And this time it was like the cherry on the cake. You bought a live session, and that's really so happy to see your success, and very happy, and all the success for your future endeavors as well. So now I take this opportunity to call upon Suresh sir to please place vote of thanks for today's speaker.
Thank you, Dr. Veena, for giving that one. And again, as I said in the beginning of my session itself, one of the person who committed to serve in the field, and she's very particular about this area. I want to explore and I want to nurture and open to learn. These are the quality I find. And see, when we say something, there are many people who were in the field of psychology and related field. They think that it is a transforming knowledge. It's not a transforming knowledge. It is a skill. You cannot confine that who has done the course for 5 years regular, they will become a skilled person. No, they know that what are the skills. But she is the one, she is having the skill, and she demonstrated today wonderfully. Thank you so much for amazing session in that. It will be really useful for our parents, and not only for special children, it is for all the parents. The inputs which I have given today are very worthwhile for all the parents. Thank you so much. On behalf of the Department of Psychology, American College, and our Principal and Secretary, I thank you for today's session. I thank all the participants and for support. We are here the first day of our webinar session. Tomorrow will be our second webinar session. Please join with us. Thank you all for that. Thank you, ma'am.
Yes. So participants, kindly send your queries and feedback to mywebinarfeedback@gmail.com. We will meet tomorrow with yet another wonderful session. Thank you. Good night. Bye-bye.